Hello and welcome to Network. My name is Pumelele Zondi with your technology and social media news. Remember to stay at home if you don't have to be outside, wear that face mask, sanitize, as we do need to stop the spread of COVID-19. It is SABC Network on Facebook, Twitter and Instagram News Network at sabc.co.za, on email. This week, Twitter poll is asking you about what Facebook has said, which is that they will be prioritizing content from your friends and family on your newsfeed, and they'll also be prioritizing content that's going to uplift your mood. We are asking you about that and whether you like this idea from social media networks. First, here's what's coming up tonight. It is Media Freedom Day tomorrow. We look at the role played by the internet and social media in media freedom. There's an app that allows nurses across the African continent to communicate with one another. And in our discussion, we chat about cyberbullying. The internet and social media have changed the way news is disseminated. Sometimes journalists have made mistakes on the manner they report because of the internet and social media, but there are many times where the internet and social media have helped. It is a Media Freedom Day on the 3rd of May, and today we look at the role that can be played by the internet and social media in all of this. In 2019, Freedom House released a report that says governments all over the world are increasingly harnessing big data for social media surveillance. Many governments would say that this is for protection of citizens, but those we asked don't feel comfortable with government's ability to track what they do online.
Most governments in Africa would indicate the reasons to wanting to control the internet, to say that it's because of issues like cyber attacks, issues like national security. But then we know that it's not the case usually. Most of the time it's because they are threatened by people being able to freely communicate and to voice out their opinion.
In Africa, we've heard about governments that block the internet or social media in times of elections, as was the case in Uganda in January this year. Journalists said they couldn't file in real time. They had to run back to newsrooms in order for them to have the ability to update stories they were busy with on election day.
We must remember that the president, Yoweri Museveni, has chided social media over and over again for being a hub of falsehoods and telling lies. Now, Uganda shut down the internet and social media in the 2016 elections. In 2018, the president ordered for a social media tax. This is the world's first social media tax that is payable not by the social network companies like Facebook and Twitter, but by the users.
This blockage of the internet would then infringe on social media and the freedoms it ought to provide for people to share and disseminate information. Zimbabwe is a country that would face clampdowns on traditional media, with arrests of journalists from time to time. As we hear, it has happened in recent times too.
Before the coming in of the internet, you had the government trying to silence journalists, through the media, through their newspapers. But now we've got the internet coming in. Journalists are able to post whatever they want. A good case in point is online papers like Zim Morning Post, being run by one Elias Mambo. It has exposed a lot of shenanigans by the government, a lot of corruption within the government through the internet. Over the past year, we've recorded cases of journalists being beaten, being arrested. The prominent case being one of Vopo Chimono, who after unveiling or unearthing some corrupt activities by the government, he was arrested 3 times. And I had a colleague as well being beaten by the police. Right now he's nursing injuries because he was simply covering a court case which was also involving political activists and members of the opposition.
The Southern African nation has also faced social media shutdowns several times, also during civil strife and during elections. In Nigeria, young people used social media to share what had happened to them in the hands of the police. They did this as they participated in protests against a police unit called SARS. The hashtag against what they say is a brutal wing of the police was #EndSARS, and it took place as the country was on COVID-19 lockdown. Even Twitter CEO Jack Dorsey shared the hashtag. Media scholars say social media has helped journalists in their work, even though there are just a few cases where journalists got it wrong by publishing what was not verified.
Our press code in South Africa, which is by the South African Press Council, actually has the second part, which focuses on social media and user-generated content. In the past, we've always had the parts that focus on the press, which is like mainstream media, but now we've got a section which actually focuses also on people who are producing content for online platforms.
Freedom House says about 89% of internet users, or 3 billion people worldwide, are being monitored online. I suppose what we always need to do is to verify whether the information that's been shared on social media is factual or not before we share it to more people. All right, so now let's take a look at an app that helps nurses from across the African continent communicate with one another.
AfriNurse.com came about during these COVID times. So I was raised by nurses. My mother is a nurse, my sisters, my aunts, everyone in my family are nurses. So being at home and being able to experience, the problems that they face and the opportunities they also faced, we as a tech company, we actually took it upon ourselves to actually build something to address the problems that they're having, right? So a lot of things were coming up mostly, like things like mental health. Nurses were going through a lot of mental health issues, right? Nurses surprisingly were losing jobs during these COVID times. So we knew that actually we're in a position of building an application that can address some of these things, right? Hence we built AfriNurse. So if you go into the healthcare space, all the innovations you find there's something available for doctors, there's something available for patients, but no one is actually focusing on nurses. How it works, it's a freemium platform. So there are specific functions within the app where the nurses would have to subscribe and pay a monthly subscription for it, but the majority of it actually is free for nurses. On the app, nurses will find a job board, right? So this is one of the first specific and centralized job boards that only focuses on the nursing industry. We even made sure that nurses, for the first time, can actually advertise themselves if they're available for work to potential employers. So we switched the roles, right? We said, employers, we're gonna give you a vast database, right, of nurses who are saying they're available for work, and you can screen them before you can even call them for an interview. Mental health being one of the primary big issues, where they were complaining about they don't even have time to even want to consult, to even go and consult on their own with psychologists, for example, right? So we built a feature on the platform where nurses can actually book a psychologist and even have a consultation online on a secure platform. So we also have what we call Ask a Nurse. This is just a nursing chat. It's a professional nursing chat where nurses can actually share ideas, where they can actually collaborate, but it's designed to help nurses actually connect amongst each other. We also have another feature called the Finance Hub. So with the Finance Hub, it was just basically saying, people still need to secure their future, need to know about whatever financial products are out there. Some of them, like any other industry, were going through massive debt during this COVID time, right? Because of how they work and their structure of work, we decided to actually digitize that by connecting nurses to organizations like debt management companies and also our financial advisors. So we actually decided to actually digitize that so that a nurse, if they're looking for any financial advice, instruments or institutions, they can find the big registered institutions on our platform, and that can connect them to any reputable financial advisor. The people that we're partnering with, in terms of, let's say, wellness, we're partnering with psychologists, we're partnering with dietitians, we're also partnering with general practitioners. So people we know that they can still, within this new digital age, they can provide these services digitally, right? Or virtually, as we may put it, right? So we're also partnering with financial institutions. So institutions that we know that assist nurses in terms of being able to secure policies, insurance, or just securing their financial futures. We're partnering with those institutions. We're also partnering with what we call in our company, veteran nurses. So people who are seasoned and experienced, but now are out of job. Because as you know, nursing is a bedside kind of a job where you need to be physically active in order to perform. But if your brain is still there, you have this vast wealth of knowledge that you can still provide to the industry. It's a digital platform, so it's virtually accessible from anywhere to anyone who has an internet connection. So anyone who has a Facebook or WhatsApp can actually access this platform, and that's the beauty of it. So all they need to have is a working smartphone, right? So how we get our word there? So we have a structure and a strategy of how we're going to do it. So the first one that we thought of is to create a network effect within the nursing industry. So we have a program called the Champions Program. So where we employ nurses to come and be sort of like our voice and champions and sales people, right? So their job is to make sure they can go and sell the gospel of the platform to other nurses in every location in South Africa and beyond. And then we reward them. The second level that we're going to do, of course, we're going to do a whole roadshow. And the nice thing about just focusing on one industry, we know exactly where to go in order to activate access to this platform.
We've heard of countries that have said that they will not use the COVID-19 medication that they have received because the expiry date has passed. And sometimes medication expires because someone hasn't closed the fridge properly, or where it was kept, the place was just not cool enough. In Africa, there are many countries that struggle to keep the power on, and the power is needed in order for COVID-19 medication to be refrigerated. Now, there's a new tool called Coolbox that aims to keep things cool, even if there is no power.
This is the Coolbox, a solar-powered freezer that could be a solution to vaccine storage in Africa.
Et je pense que c'est une opportunité que notre idée, notre projet de congélateur rejoint automatiquement, immédiatement aujourd'hui, et nous encourageons donc les spécialistes et les animateurs des services de santé et des ministères de santé à s'associer à nous pour pouvoir trouver des solutions.
Research by the Global Health Science and Practice found that nearly 60% of healthcare facilities in sub-Saharan Africa have no access to electricity. Amongst those that do, only 34% of hospitals and 28% of health clinics have reliable 24-hour access. Efficient health services and responses to disease, including COVID-19, depend on reliable access to electricity.
Les vaccins qui commencent à rentrer dans nos pays en Afrique, au Sénégal, en Côte d'Ivoire, nous avons les premiers vaccins qui sont rentrés, exigent une chaîne de froid particulièrement importante et rigoureuse. Et si nous n'avons pas, si le département, les ministères de la santé n'ont pas cette logistique froid, autant dire que les populations les plus reculées ne pourront pas avoir accès aux vaccins.
Though a technology particularly important amid the global health crisis, people like fisherman Antoni Fiani use the freezer to store fish. His home is located on an island in the southern Ivory Coast and it's not connected to the electricity grid.
Ma femme et moi, on fait commerce de poissons, on vend des poissons. Il y a des poissons, quand ça arrive, il y a aussi on arrive à fumer et il y a aussi on arrive à conserver. On prend de la graisse, puis on conserve ça 2 jours, 3 jours, on s'en va, elle va sur le marché pour les livrer. Aujourd'hui, oui, on a vu que dépendre de la graisse, ça peut tout. Donc on va prendre le frigo pour qu'on puisse travailler avec ça.
PEG Africa is currently piloting the solar-powered fridges in Ivory Coast and Senegal with the fishing community. And with funding from Power Africa, a network of private and public groups set up by USAID, PEG started providing solar-powered systems to off-grid health clinics, which could help drive the COVID-19 vaccination campaign.
SABC Network on Facebook, Twitter and Instagram. News Network at sabc.co.za on email. After the break, we chat about the scourge of cyberbullying. It is SABC Network on Facebook, Twitter and Instagram. News Network at sabc.co.za on email. Welcome back. Now, cyberbullying is an issue that's been in the news quite a lot lately, especially when it comes to children who spend a lot of time on their digital devices. Microsoft says their research found that in 2020, about 40% of high school learners say they've been victims of cyberbullying. This research was done in about 32 countries. In South Africa, the CSIR says that children, more than adults, are often victims of cyberbullying. Just recently in Gqeberha, we heard about a high school learner who allegedly attempted suicide when fellow high school pupils posted unflattering photographs of her online. We also heard about Lufuno Mabunga, who committed suicide after a video of hers being assaulted by another high school learner was circulated widely online. Now, to talk to us about cyberbullying is Dr. Winnie Ngongo, who is a psychologist and an academic at the University of KwaZulu-Natal. Hello, thank you very much for joining us, Dr. Ngongo. Maybe if you can start by explaining to us what cyberbullying actually is.
Hi, hello. Cyberbullying, the other name that we use, we call it internet aggression. It involves sending messages, emails, or posting harmful images or messages about people. Some of them, they use chat room, they use computers, they use social platforms, they use images or pictures that they post that they actually negatively give the bad name about the person, or spending or spreading wrong rumors about the person.
Even though research says that it's children who are often victims of cyberbullying, adults can be victims too, right?
Adults can be the victims of cyberbullying. Why? Because there are so many people that are stalking. There's this thing called stalking, especially in love relationships, where one partner is busy stalking the other about his or her whereabouts. Other people, they even use the tracking devices of cars, the partners, where they will be checking now and again on their partners about their whereabouts. That is stalking a person. And also going through their cell phones, that is also stalking a person, because that is not allowed. And also triggering a person, or sending wrong messages to people or emails to people. So even adults can have or can be the victims of cyberbullying. It's not only about children.
Dr. Ngongo, as a parent, how can you spot that your child is either a bully or that your child is being bullied online?
Adults, they've got a lot that they need to do, or that they can do, the strategies that they can do, or the approaches that they can do to prevent cyberbullying, or to prevent their children bullying others, either at school. Adults, first of all, they need to go through their children's devices, either their cell phones or their computers. Because what children normally do, they will pretend, if they are both at school or they are at home, they will pretend as if they are researching some information that is needed at school, or else they are studying. Yet they are using that time or going through internet to bully others, to cyberbully other students or learners. So by creating awareness to their very own children, not to wait for the educators at school, because now and again, it is beyond maybe principal or educator's authority.
Now, Dr. Ngongo, you're a psychologist. So what should we do in order to start seeking help and advice if we find that we have been victims of cyberbullying, or that our children have been victims of cyberbullying?
Take your child to the mental health practitioners or providers, because they are having more or in-depth knowledge of how to counsel those people. So they will be conducting counseling sessions. And then also, if it's the adults also need to go one and the same route, where they need to see the mental health practitioners. So because their mind, it is being affected psychologically and mentally, especially that cyberbullying. Remember, it's having risk where one can develop mental health and safety problems.
All right, Dr. Winnie Ngongo, thank you very much for being a part of our network. And with that, let's take a quick commercial break. It is SABC Network on Facebook, Twitter, and Instagram. Welcome back. Here's what else took place in the rest of the world in the technology space.
Apple began rolling out an update of its iOS operating system with new privacy controls designed to limit digital advertisers from tracking iPhone users.
Apple is responding to a real consumer desire for privacy, and that desire exists among Apple users, but exists among all people who are using mobile software and mobile apps and mobile phones. So they're the first of many that are going to make this transition to better protecting privacy while enabling advertisers to understand what they're doing without the individuality of knowing exactly what a person's specific behavior is.
Data collection is still allowed if it is spelled out in an app's privacy policy. The changes only affect whether app developers share data they collect with third parties or mix their data with outside data from third parties to help target ads. Apple has introduced privacy nutrition labels to its App Store to show users what data apps collect, and now in Costa Rica. A space radar capable of capturing small objects that threaten the safety of astronauts and satellites was inaugurated at a farm in northwestern Costa Rica.
This is the most advanced commercial radar in the world for tracking space objects. It's for a few reasons. This radar was designed to track very small pieces of debris. It turns out there are about 250,000 pieces of debris in space that are 2 centimeters in size and larger. They aren't tracked today, and they threaten satellites. In space, everything moves so quickly, approximately 8 kilometers per second, that even if a tiny piece of debris hits your satellite, it can destroy it.
The radar installation, called Costa Rica Space Radar, can monitor objects that transit in low Earth orbit in the region of the planet near the equator, an advantage offered by the Costa Rican geographical location. More news from out of space. NASA has announced yet another first on Mars, having literally created oxygen out of the red planet's thin air. That's thanks to an experimental device carried by the 6-wheeled rover vehicle called Perseverance that landed there in February. The gadget is called MOXIE, and in its first activation, it created 5 grams of oxygen from Mars' atmosphere, which is mostly carbon dioxide. That's enough for an astronaut to breathe for 10 minutes. It may sound small, but that's big news, marking the first experimental extraction of natural resources from another planet that humans can directly use. NASA says it's the first technology of its kind that may help future missions live off the land of another world.
Facebook has said that from now on, they will be prioritizing information that uplifts your mood in their news feed. They've also said that they will be prioritizing information from your friends and family. They've taken a lot of flack in recent times for prioritizing information that advertises to us. So this week, our Twitter poll is asking you if you think this move by Facebook and possibly other social media networks is a good idea, and which do you prefer? Now, 16% of those that responded to our poll say they prefer to see marketing content online. That's in the minority. It's tied with another one, though. In the majority are 46% of respondents who say they prefer seeing content from friends on Facebook or on other social media platforms. There's another 16% tied with marketing content, and those are people who say they want to see content from families. It seems like not really that many people want to see content from family members on social media. At 22% are people who say they really are indifferent about all of this. So the majority wants to see content from friends and family first and not marketing content. That's it. That's all we have for you. It is SABC Network on Facebook, Twitter, and Instagram. It's News Network at sabc.co.za on email. Remember to wear that face mask. Stay at home if you don't have to be outside, and sanitize your hands if you don't want to wash them constantly. We need to stop the spread of COVID-19. For me and the rest of the team, have a good one. It's good night.